So, welcome everybody. I'm Christine Cunningham, and Kelly, you introduce yourself while I get the slides up.
I am Kelley Hassenpour. I am a nurse psychotherapist. I am located just north of Toronto. I'm sure Christine will do her own little intro here as well, but I came to IFS through my own perinatal journey. I had postpartum anxiety. I always say it was my going to my own therapy when my therapist mentioned the word managers, and my managers very much liked that. And so that's sort of how I found my way into IFS was through my own journey. Since then, I work predominantly with the perinatal population. I also work with other therapists who are looking to do their own IFS therapy. I am trained through the IFSCA, and I've done their Stepping Stones and Stepping Deeper course. And Christine and I both just have a passion for this work, especially with perinatal clients, and found our way to each other to be able to start offering a training program. Christine,
Yeah. Yeah, so I'm Christine Cunningham, and I am in Durham region, and I came to this work. I'm a registered social service worker, and I came to this work after my third kid, and I had postpartum anxiety and depression. The anxiety was quite severe, and so kind of after my recovery from that, thank goodness, I decided, okay, I want to do something related to that because I was not in this field. And so I went back to school with three kids. I'm still like, wow, why did I do that? But I'm glad I did. And here I am. So yeah, and then I was in addictions and mental health front line for a good chunk of time and then moved into private practice and really then focused my practice on perinatal and perinatal mental health, took trainings for that, and then found IFS. It was recommended to me by a friend and a colleague, and I just really resonated with it. I did my level one training with the IFS Institute, and then both Kelly and I have done a bunch of, other ad hoc trainings with Frank Anderson and other folks in the community. So, yeah, it's been great. I love this work too. And so, like Kelly said, we came together to bring this training to you all, and we're super, super excited because we feel that IFS really fits in so well with the perinatal population. Anything I missed there, Kelly?
I don't think so. I think the only thing to say too, maybe just specifically about our approach to IFS as we start to jump into it, is that Christina and I both fully believe in taking the model and making it meaningful for you and for your clients, and really like adding it into the work that you're already doing and not feeling like you have to like come away and only do IFS. I think too, Christine and I, and hopefully you'll see in the demo, have both taken it and made it work for us. So we maybe somewhat, I think, sometimes take a little bit more of a relational approach to IFS as maybe some of the other demos that you've seen. So we really just encourage everybody to be able to take it and make it meaningful and work for them.
Absolutely. Yes. And so today we're just going to give you a brief overview of the model, of course, talk about applying IFS for perinatal care. We're going to do a little demo and have time for Q&A and talk about the training program. So this is just a very like basic model, so to speak, design of the model that I made. And basically the IFS model, if you haven't heard, anything about it, is, the model says we all have multiple parts. And those parts can be feelings, diagnoses, trauma, our roles that we play, like my mom part or my, social service worker part or my, friend part. And we also have parts of daily living. Kelly always uses like her banker part that gets her banking done, right? Or like, if I gotta do the groceries or something, maybe I need some organizational part in there to help me out. And we have our protector parts too. Sometimes those protector parts use healthy coping strategies. Sometimes they use unhealthy coping strategies. And that's usually the place where people come to us in counseling. And at the core, we have ourself. Um, and of course, remember, these words are all social constructs. They are made up by someone. And so lots of people come with lots of different words that they use for these. But we will use the self as a reference. Some people say my core, my soul, you know, me. A lot of times I'll use a client's name. Like I'll say, what would Kelley do? Or Kelley, in Kelley's core. And so that's kind of our guiding force. That's where we hold our beliefs, like our core beliefs, our values. And then we talk about those qualities of the self, as they've named them, the 8 C's and the 2 H's. And I don't know them off the top of my head, but mainly the ones I run to that I go to are compassion, calm, clarity. What else is in there?
Courage.
Courage. Yeah.
Those are usually the ones that mostly come to me, and I find that clients come out with sort of on their own. And I
Yeah.
think another important part is you don't need to memorize the model and you don't need to memorize what those things are. It's just being able to recognize what it feels like for yourself in session and also what it feels like for your clients to be able to access that.
Yes. Absolutely.
So, like we said, both Christine and I have found that the IFS model just like we think pairs beautifully with the perinatal population. And really meaning anywhere from like fertility journeys through, and I always say I'm like postpartum, but for me, postpartum is like many years long. Um,
Forever.
yeah, forever. And so, really, and I think too, especially those like early years of parenting, because it offers this like really gentle and compassionate approach and a really non-pathologizing approach for those like really intense inner experiences that are common during this stage. And so like our favorite reasons as to why it pairs beautifully with the perinatal population is one, it like normalizes inner conflict. I'm sure everybody here who works with perinatal clients know that clients often experience conflicting feelings, the joy and the grief and the love and resentment and the hope and the fear. And IFS really helps clients to understand these as parts of themselves and not all of themselves. And that they each have a valid reason for being present, and really looking at it as rather like as a valid reason as opposed to a sign that something is wrong. And I feel that this can be incredibly relieving for new or even expecting parents who feel like they're like all over the place all the time.
Yeah. Absolutely. And it fosters self-compassion. So again, that compassion word, that's one that I resonate with so much in myself. And when myself is present, I can feel that compassion, of course, for my clients, but for me too. And as a parent, right, on the flip side of like being able to access that compassion for myself as a parent, and helping my clients do that of like, this is hard. It is hard, or it is sad, or it is difficult, or it is exciting. It's all of the things. And how can you foster that self-compassion to be able to get to know the parts that are showing up in your parenting journey, like those ones that Kelley named. But again, that feeling connected. And I'm sure a lot of you have heard this, or maybe even felt it yourselves. But we have clients that come to us that say, like, I'm not a good parent, or I'm not a good mom, or I should be happier at this stage. And really, this model is about trying to explore all those parts from self with that compassion of like, it's okay that all these parts are showing up.
Absolutely. It also really supports identity transformation. As you guys know, becoming a parent involves profound identity shifts. And I feel that IFS allows clients to explore the parts of themselves that maybe feel lost or uncertain or that feel left behind while starting to integrate new parts that emerge through like pregnancy or fertility journeys all the way through those early years of parenting or maybe beyond. And it really helps clients hold space for both their old self and their new self. I think what's really interesting about both Christine and I is that Christine and I both had the experience of postpartum anxiety, but we conceptualize our experiences very differently. Where, and we talk about this like sort of at length throughout the training, but that Christine, not to put words in your mouth, but having done the work with you for a long time, really identifies her anxiety as like a biological part of her, where I very much identify, like, I resonate with the idea that my postpartum anxiety was a whole bunch of parts who were overwhelmed. And I always just say we're freaking out. And so for me, I used this like at the time, it felt like a blanket term of postpartum anxiety, but now I really realize it was like my fix it parts and my perfectionism parts that were all just in this like wild state of chaos, feeling like I said, like uncertain and lost and left behind. So for me personally, and I find for a lot of clients, it really helps to like work within that frame for identity shifts throughout parenthood.
Yeah, absolutely.
Yeah.
Yeah.
It's also effective for trauma and attachment work. I always say, I'm like, there is no bigger like activator for parents. I think, infancy for sure. But I don't know about you guys, but I see a lot of clients in toddlerhood show up as their toddlers are just toddlering and folks' attachment wounds in intergenerational trauma starts to show up. And so IFS provides a framework to help heal these early experiences that are often being reawakened by pregnancy, birth, or parenting, which really allows the clients, hopefully, to respond to their child from a state of self energy rather than these wounded parts. And gives a framework for clients to be able to understand like where maybe some of their bigger reactions are coming from. And I think also helps to bring in that self compassion to why is it showing up and being able to explore that.
Yes. And what's interesting too is seeing, those wounds at different stages. Like Kelly said, yeah, I see it too a lot coming in toddlerhood, but then also a lot of times where like at different ages of their kids, their inner parts, as we call them exiles, their trauma wounds need to be healed at those different ages and stages. So that's interesting too, how that work mirrors kind of the stages that their kids are at, even into teenage, adolescent years, and beyond, of course. And that brings us to grief too. Like this, we find IFS works so well with grief and loss. And really, again, that non-pathologizing kind of present work of like, this is where we are right now. Like, we are beside you, supporting you in this grief and developing a grief part. Yes, when we dig deeper and we look at these manager parts that are trying to protect us with maybe unhealthy coping skills, there's some shifts and things that we might encourage, or, if the client wants to change them, we support them in that. But grief is really this part that we develop, and we want to foster a relationship with it. And we want, to have a good relationship so that, again, if my grief comes up, maybe on the anniversary of a due date or anniversary of a loss or something like that, that like if the client wants to, if the grief part wants to, I can access my grief and I can give it space. Again, with that compassion, with that curiosity, but that really helps with the healing and the integration because we can separate the trauma, if there was trauma in the loss, if there was a traumatic loss, and we can do that trauma work, but then that grief work also comes and we can create a beautiful space for that grief work.
And just to add to that too, I think it also is a beautiful framework for not just working with grief in the sort of sense of trauma and loss, but also it really normalizes grief, or it gives the opportunity to normalize grief as a normal process and common process of parenthood and becoming a parent. And again, seeing it as being valid and that it's there for a reason, as opposed to just, I think a lot of clients are left without the words or the ability to express that what they're feeling maybe is a grief or around missing your life before kids, things like that. So I think it is a really beautiful framework for that as well.
Yes, and with clients going through fertility journeys where maybe there isn't a loss in terms of a miscarriage or a release of a pregnancy, but a loss of maybe a transfer that didn't take or didn't result in a pregnancy, you know, also honoring any grief that comes up in those situations. Yeah.
All right, so that is why Christine and I love IFS. There are just a few reasons why Christine and I love IFS, working with the perinatal population. And so we thought we would jump into doing a demo on something that I know Christine and I both see commonly through our practice, which is quote unquote the term mom rage, which I absolutely despise the term. But I think again, IFS is such a lovely framework to work with perinatal rage. Because again, it sees it as for, a lot of women have been told that rage and anger is not okay. We're supposed to be quiet, we're supposed to be small, all of that. So the shame that's involved with experiences of anger and rage, I think this really provides the non-pathologizing view of anger, as well as just developing that relationship with it, like Christine said, to really get to what the core meaning is underneath the anger as well.
Yeah.
So for our demo, I'm going to play the part of the therapist, and Christine will play the part of the client. And we always say through this is yes, this is going to be a demo, but we'll be tapping into real stuff. So thank you, Christine, for doing this and being vulnerable with us.
No problem.
So with that, everybody's got their cameras off. I'll give you a second, Christine. I know you don't love to close your eyes, so I will invite you to do whatever you want with your eyes. Maybe just take a couple of deep breaths and just like notice the floor underneath you, whatever you need to do to center yourself in the room. And I'll just get you to turn inside.
And I do feel a tightness in my chest.
Yeah.
I know is not my anxious part, and I know that because it's a it's like spreading. It's a bit warm.
Yeah.
Yeah, it's different from my anxious part.
Sure. Okay. Does it feel okay to just focus in on that feeling
Mhm.
in your chest right now?
Mhm.
Maybe just take a breath or two, focus in on it.
It got bigger,
Yeah. Great.
gone into
Yeah.
my stomach actually.
Yeah. What else do you notice about it?
Yeah, it's just kind of it is radiating a bit through my arms of like an energy. Like,
Sure.
you know, for me, I feel like anger carries energy, like physical energy with it. Like it
Yeah.
wants me to move.
There.
So,
Makes sense.
yeah, I know you
Yeah.
can't, but there's my teacher part that wants to,
Starts coming in.
yeah, that wants to tell everyone like you'll notice I'm gonna fidget a lot and move a lot. That's this part that's really here.
Yeah. I wonder if that's your fidget part or if that's a different part that wants to just let everybody know why you're going to fidget a lot.
Yes, definitely. Yeah, another part for sure. But it's okay.
Okay. So does it feel okay? Do you feel like you can ask your teacher part, maybe your fidgety part, if they let you focus in on this feeling in your chest that's radiating?
Yes. Yeah, they moved aside right away because now I feel that
Sure.
radiation more.
Great. Do you notice anything else with that radiation? Do you notice like a temperature or color, get a visual at all, or is it just that feeling?
Just like the more like heat, warmth in it. And I do get a visual of me, like honestly,
Hmm.
kind of like shouting at my family
Okay.
because no
Great.
one's listening to me. That's I
Yeah.
see that visual right there. And I'm
Yeah.
looking away because it's helping me focus.
Sure. Yeah, absolutely. Okay, so you're getting this visual. Do you feel like you have some space between you and this part, or does it feel like it's close to you?
It's like I'm watching the scene, so I do see her as a part. However, I do like still feel that in my chest, like it is my own anger, which it is. And I know when I am angry with my family that like I'm in it. Like
Yeah,
I'm just like, I'm mad.
it overtakes you, fully blends with you.
Yes, yes, yes.
Okay, maybe just take another deep breath. Be with this part in whatever way it needs you to be. And as you see this version of you who's angry at your family, Do you notice any other feelings coming up towards it?
It just like me here, I'm just like, girl, you're so tired.
Yeah.
Oh, you're so tired.
Yeah. So almost like a sense of compassion.
Yeah.
Yeah.
Yeah, like I get it.
Yeah. Can you send that sense of compassion towards the anger in whatever way feels right for you?
Yeah, she's like, thank you.
Yeah, of
Yeah.
course.
She's
Yeah,
sitting down at the table, like in a chair.
sure. What else does she want you to know? It sounds like she's aware of you there.
Mm. She's like, it's too much. Like, I
Yeah.
have too much on my mind. I do too much in this family. And, like, yes, my husband helps and he's great. And I feel like my kids don't appreciate me. I feel like it's just too much
Yeah.
what I'm getting.
Yeah. I'm curious to know, is it this version of you who's, I think, is she sitting at a table
Mhm.
or sitting, is she holding this feeling of my kids don't appreciate me?
Oh, Kelley.
Oh, Christine. Yeah.
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 Which brings in sadness.
Of course. Yeah.
She's like, actually, there's anger,
Mhm.
there's sadness at, how sometimes a logic part's coming in and saying,
Yeah.
I know they're kids, like they're teenagers. Like, did you appreciate your parents when you were a teenager? Probably.
Yeah.
Um, and if I ask that to step aside,
Yeah.
yeah, there's sadness here in my heart.
Sure. Yeah. Does that make sense to you that there would be some sadness there?
Yeah.
Yeah. And also, does it make sense to you that sometimes maybe that sadness pops in as anger?
Yes.
Yeah. Yeah.
And I'm getting the sense of like, yeah, that sadness is really coming in because it feels
Yeah.
lonely.
Of course. Yeah. Does this sadness just need some space right now?
It's like I need you to be here, actually. Like, yeah, like the sadness is like also like sad that I'm the only girl in a house of four boys. Well, I have my dog Maisie, so it's just me and her
Yeah.
and four boys and a boy dog too.
Yeah.
So it does like sometimes I feel alone. I feel alone in my experience as a woman. Oh, wow, there's a lot of grief there.
Yeah. Is
Oh,
it okay to be there? Recognizing that we are still in the midst of a demo. Yeah.
yeah, it's okay.
Okay. Yeah. Great. Welcome it.
Yeah, I've, it's interesting. Yeah, it's like a lot of grief around my experience as a woman and even physically, like dealing with what's going on in my body, or, I
Mhm.
am 13 years postpartum and in perimenopause, but I do remember that sadness being there when I was in the midst of having kids.
Oh, yeah.
Yeah, and just feeling like my partner, who is a man, will never truly understand what this feels and how hard it is on my body.
Absolutely.
Yeah, it's
Yeah.
really,
Yeah.
yeah.
Does she have anything more she needs to share with you?
She's she's just saying like I need something, but I don't know what.
Yeah.
Like I need something to help with this grief of being, you know, just me and my girl dog in a house full of boys.
Yeah. Okay.
She doesn't know what though.
Yeah. Can we give a minute to maybe just sit with that?
Mhm. I'm just gonna sit at the table with her.
Yeah. Does she see, like, she's aware of you there? She knows who you are?
Yeah. And
Yeah,
we're sitting at the table together.
yeah,
I think it's that like community piece or like
yeah,
connecting with people outside of my house,
yeah, yeah,
like no one in here gets it. Oh, I'm gonna cry again.
yeah.
Oh, fuck, they don't get it.
They don't. And I was like, I have a part popping in who's like, I know, I also live with boys. Yeah,
Yeah.
yeah.
I
So what?
think yeah, that connection to people outside of my home
Yeah,
that is helpful for me. And, when we talk or, talking with other friends, even in like situations like this or trainings where like other people, even with clients where they share similar parts and inside my part is like, yes, yes, girl, come sit at the table and have a cup of tea.
yeah, absolutely. And what about for her right now, having that cup of tea with you?
Mm. Let me take a sip of tea.
Yeah. And it sounds like you just had a really great sense of clarity around what this grief needs from you.
Mhm. Yeah, that acknowledgement. And I think I feel like that grief part feels like a part of the grief is that I will never get that um, recognition or acknowledgement or understanding
Yeah,
from my kids and my husband.
yeah,
So I think that grief will just always be there.
absolutely.
Like I'm here to stay.
Yeah. Can
But
you let it,
really, go ahead.
I was just gonna say, can you let it know that like you're hearing her, you're getting it?
Yeah, and that like that feeling here in my chest that came with the anger is not even it's like I'm doing this, but it's like
Yeah,
dissipated. Like
sure.
it's not even in the house.
Okay, great. And so going forward with her right now in this grief and understanding that that grief is always going to be there, do you get a sense at all of what it needs from you?
That energy, like again, it's not anger because anger's not here.
Mhm.
It's like there's it feels threefold.
Yeah.
There's the acknowledge like feeling like sitting with her at the table, acknowledging like this sucks, like it does feel sad is a very important piece.
Mhm.
And that like the grief around my kids and my husband never fully being able to understand what it feels like to be in a female body,
Yeah.
that grief will always be there. So if like just keep um how do you say it? Acknowledging it.
Yep.
Then there's part of the grief that's like, and I need connection with people who do get it.
Absolutely.
Yeah,
And may I throw something out there that if I was working with an actual client, I may not be this direct, but may I add just a piece of curiosity for me too? Is I'm curious to know if there's an element of a cultural burden there too,
definitely.
of
Def-
knowing that, like, yeah, that whole individualism and knowing that if we didn't live within this burden of individualism, that you would have others around you.
yes. Yeah, and like and that even a lot of like outside burdens of just even when I talk to my kids about this stuff because I'm a social service worker, I talk about this stuff with my kids all the time. And uh so I have to say actually when I come out of the anger, when I'm more in myself, I see moments where like my middle son last cycle was like, "Oh, how's your uterus feeling?" And I was like, "Thanks, dude. It
For asking.
hurts." Yeah.
Yeah.
So I can actually see where there's also, you know, times where they are picking up you know,
Mo-
moments and things that I'm putting down. So that's helpful.
yeah.
And yeah, so there's a lot, I think, longer than we have time for, but a lot of like misogyny and sexism and that comes in there of I think too like I think that's where the anger also comes in of like I'm not just angry at my kids because also I can recognize like it's not their fault, like so to speak.
Yeah,
That there's a lot of socialization that's happened outside of our house
absolutely.
where I'm like, oh my gosh, like I've tried to talk about these things so much and talk about, women's experiences and being more compassionate, and then they come home and or like watch things on the internet and say stuff that doesn't align with my values or our family values. And I'm like, what is happening?
Yeah,
That's where the
absolutely.
anger like kind of latches onto that.
Yeah. I was curious now that you say that if you're able to invite anger back. And
Mhm.
if it can't, that's okay.
It's interesting. It's like by inviting it back, it's like, I'm here.
Okay.
What do you
Great.
what do you want to talk about? But I'm not like it's not in my chest like oh.
Great.
And that's the third component,
Yeah.
which I think is tied to the anger because for me, again, anger can be like an emotion of taking action.
Yeah.
And it's like I need you to speak up. Like I
Yes.
need you to keep explaining things to your kids and your partner of like how you feel and why it looks like I'm always lying on the couch, for a week, a month, or whatever. And like I think for me it's like I got to make that connection, like I did of yeah, and there are times they do pick it up. They do get it,
Yeah.
you know? Which is good, which is good. Like I can do what I can do. And
Absolutely.
I think to keep like just again reaching out to community for support for me, but also talking about these things with clients, with friends of, how are we supporting each other in this and finding community in different ways if we can't find it, in our home, like you're a boy mom too, and all those things, right? So it's like, yeah, I need you to still speak up about it and still talk about it in a way that is supportive for me and others.
Does it feel genuine to thank the anger?
For sure.
Yeah.
Yeah, I'm
I
like,
am wondering as well if it feels okay to let the anger know that, like, it's also okay to let that grief pop out sometimes.
yeah. Yeah, it's like I agree. I agree. Keep talking. Again, what all my parts ones, like keep showing up for us, like keep checking in with
Yeah,
us,
absolutely.
and just I think my mom part being like, girl, go sit on the couch.
Yes,
What?
you deserve it.
Yeah.
Go take some rest.
Yeah.
Okay. I would like to thank all your parts who showed up.
Thank you.
If it feels genuine for you to thank them all,
They're like, yeah, no problem. Yeah.
awesome. I mean, my automatic response is that, like, especially with anger, when a client says, I don't know. And so for me, it usually means there's another part present. There's something blocking the client from being able to access the anger and what the anger needs. And so then I would turn towards, so even like an I don't know part is an I don't is a part about voicing a need, because I think all of us like can probably like relate to the idea that as socialized female folk, it can sometimes be really hard to tap into like actually identifying what we need, or the idea of even verbalizing it can feel scary. So I would sort of turn towards that and what is blocking the access to that angry part. Sure. And I think, but even taking that and understanding, like, for many of us from the time we were young, like, one, would a parent often ask us, what do we need? Like, sometimes even that idea is foreign, and
Mhm.
just being like really gentle with it.
Yeah. I think the kind of maybe the difference sort of with IFS is like we stay with it.
Mhm.
Like we don't rush it. Like I don't have an agenda of getting an answer and I don't know the answer. So it's also when we model that um like slowing down and just being present and being patient, oftentimes that helps the clients get there too, of like there's no rush, like and also that a lot of times that indicates for me is like maybe the client isn't actually like I was in here like talking to my parts. Like that's why I was looking off screen because I was visualizing it at the same time we were doing it. But sometimes clients don't do that. So when I ask like, what does the, anchor part want you to know? And they're like, I don't know. Because they're not actually inside in communication with the parts, if that makes sense. So again, I would try to guide them like, do you see your part? Like again, just coming back to like the foundation of like, do you see your part? Like Kelley asked, like, do you see it or are you like, you know, close to it or far from it, like kind of unblended or blended? So I'll check with clients to see if like they're actually engaged with that part and getting
Yeah.
an
And
answer from the part versus trying to just make up an answer.
I was gonna say, for me, that still sounds like a blocking part. It's like oftentimes, like when you go somewhere deeper, like with the anger, all of a sudden, like a thinking logical part will just like suck them back up out of it. And now you're trying to see that they're like responding from a thinking part as opposed to the like feeling part.
Which actually, my thinking part came in. My
Yeah.
logical part came in and said, well, they're kids, they don't know. Right. And I was like, I'm just going to ask that part to step back.
But with somebody who's not like a therapist and familiar with the model, sometimes it's up to you to kind of catch
Yeah.
of like, oh, it feels like another part just popped in.
Yeah. And that's what I wanted to say too. And I'm very proud of that. I was able to ask my teacher part to step back. But during, I did want to say too that yes, obviously Kelley and I use IFS every day with our clients. I use IFS for myself. And so I have a lot of practice of engaging with my parts, finding my parts, visualizing my parts, where that came into it for sure. That, with a first time client or something, it's not going to look maybe that smooth, so to speak, but sometimes it does. Like I have clients who really connect with IFS. And now that we've been working together for a while, yeah, my sessions are like that too. And that's the thing is that, I think as therapists, as helpers, in the helping professions, we always talk about like, you got to do your own work to help other people do their work. And sure, like, I said that for years. Um, and then for me, what when I started to learn about IFS, it clicked for me personally too. And then all of a sudden I was like, oh, that's a part, that's a part, that's a part. And so doing my own IFS work, both with a therapist, both on my own. I like to journal a lot, and journal from my parts and about my parts, which I find really helpful. That is a key piece in, using IFS with clients is like understanding kind of how it works. Yes, it's different for everyone, but having that deeper understanding, and also working with our parts. That's why that's a big focus in our training is we're not just talking about clients' parts that can come up. We do talk about that for sure, especially those perinatal specific. But in those practice sessions, it's your parts that are coming up. It's real, right? We can't fake it really. So, I mean, I'm sure we have parts that could, but all what I'm saying is, like you saw with the demo, those are my real parts, and they just, and even like that grief that came in, and I had tears, and I was like, oh, Kelley, because that part just came in, right? And so that's so helpful for us that when we are with clients, for example, I've had postpartum anxiety. I had a part that didn't want me to go on meds. When I first started working with perinatal clients, and I had clients who would say the same things, exact same things as me. I don't want to take meds. I'm going to be broken. It's going to mean that I'm giving up. Da, da. Word for word, the same I was feeling at that time. My parts came in And so sometimes I'd be like, well, I think that medication would be a really good idea. Like maybe you should talk to your doctor. Like, no, I don't want to. Well, I really think, where when I asked those parts to step back, when I really did more work with those parts, it was like they could step back right away. But at first, they were coming in when my clients were showing up with similar experiences to me. And that's human and that's normal. It's our parts coming in. But when we work with our own parts, it's really that supportive place for us as the practitioner to ask our parts to step back and try to be in self as much as we can in the session. And that's a big focus of the training.
I often refer to it as whack-a-mole. Like especially when you first start parts work, either yourself or with a client, it can feel like whack-a-mole, where like the parts are like me, 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 me. Like, and it's just, yeah, calming your own system and being like, okay, we got this. Like I can handle this. And then yeah, working through whatever parts of you are getting activated for sure.
Absolutely.
Yeah.
The goal of IFS is to get to know our system, or help clients get to know their system, being able to recognize parts when they're present, and to also be able to recognize and it like come into self, right? Like connect with self and to use that self energy to, if there's parts that need to be healed, to heal those parts, um, protector parts, to unburden them from that, I have to protect, this person from this because if I don't, she won't be good enough or she'll be a bad mom. So we want to help heal those protector parts, unburden that feeling, and again, uh, trauma as well, like from self, being able to process trauma, heal those wounded parts. And also, like you said, with that chair example, so they did that in my IFS training, and I was the demo. And I was in two chairs going back and forth, back and forth, back and forth. It was the wildest thing. It worked. But yes, when we have inner conflict or we have a decision to make, trying to again access self so we can recognize what parts are coming up here. Okay, I have a part that wants to agree and I have a part that wants to disagree, right? And then visualizing, a lot of times I'll just say, put those two parts on a basketball court or a tennis court or in two chairs. And like instantly there's a shift because they see them as two parts instead of like, we're all scrambled up and I don't know what to do and I don't know how to decide. But it's making these decisions, it's navigating these situations with your family, with yourself, with your parts from self, where our values are, where our goals are, where, our compassion is, maybe humor, or, from self. Kelley,
I
what would
think it's like a very big question for a short amount of
you?
time. And
Yes.
there is no like set answer. For me too, it's a lot of like understanding why I do the things I do or why I behave the way I am. Also understanding and using that to be like, so I always think about like when a client comes in and is like, I'm so afraid my child is going to feel X. Like I'm so afraid my child is going to feel alone. And so I do all of these things to make sure that they don't feel alone. And so for me, I'm like, when I look at that overall, especially like in the perinatal sort of population, is thinking that like those protector parts are the parts that are doing the things. So maybe it's the researcher or the fixer, and I'm so exhausted because I'm being run by those parts. And a statement like that tells me there's a little wounded part in that client that feels alone, right? And is probably activated by something that has happened. So I think of a client specifically who's like, I'm so afraid my child is going to feel all alone and scared in the middle of the night. For me, I'm always like, do you have like there's a part in there that felt all alone and scared in the middle of the night? And usually you'll eventually end up there to this scared little exile who has all these protectors around them. And it's just feeling like less compelled to do the things you do than being able to like consciously say, you know what, I need help. I need to do some research on this, as opposed to being like, I'm going to scroll the internet for like 5 hours tonight trying to find the answer that has no answer, like to the question that has no answer. And then another thing that just popped into, especially with the perinatal population, for me, the goal of IFS is to understand what are my beliefs and what are beliefs that have come from outside of me. So
Yes.
whether it be like cultural burdens that I bear of individualism, of capitalism, of ableism, patriarchy, all of that that I have internalized and had no idea and are showing up now as rage because I'm seeing the internalized patriarchy in front of me every time I thank my husband for changing a diaper, right? Like there's usually this like internal war that then starts.
Yeah.
So for me, it's a lot of that. And then maybe helping to unburden some of those beliefs as well.
Yeah. Which again, just to come back to this example that you saw, is previously, and it in real life, that mom part that has felt overwhelmed, unheard, touched out, sensory overload has escalated to rage and yelling. No one listens to me, no one does their chores. That is how I have been in the past. And yet that didn't happen today because with self and with Kelley's self energy, I was able to go in and see those parts and say, like, hey, I see you. What's going on? Instead of letting that anger flood me and no one's listening to me still. So then I'm going to escalate to rage because that makes them all listen and then do their chores for like a month. And then we go back to the same thing. I digress. But so it's that piece where like that took time to get where that those parts were today. Whereas in the past, yes, they have escalated to mom rage and to shouting or yelling because I felt like I had no option
Yeah.
and my nervous system was overloaded. So that's kind of that's how self energy can help those parts. Yeah.
So with our final 3 minutes, should we
Yeah.
let them know about the
Yes, 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 yes. Let's talk about the training.
okay.
So, yeah, go ahead, Kelley.
Go for it. Go for it.
Okay, so yeah, so with our IFS Pathways training, so our this particular training is called Parts in Transition, and so this is like some agenda highlights of what we will be going over, and this might not mean anything to you all, and that's okay. But we are really gonna go in depth into the model of like each of those pieces of the model, like what is that really? What does it mean? What does that look like? Again, in more depth, talking about IFS and using that with perinatal clients. And also throughout this, just know we're not here, and the goal of this training is not to drop all of your previous training and only use IFS. It is to integrate what you already do. And so, of course, like Kelley and I both pull from like things that we've learned along the way, right? There's some things that are just those nuggets that work so well in certain circumstances. Yeah, we have a lot of people that come who, currently use ACT or EFT. Again, like we said, narrative therapy pairs really well. It's kind of like really bringing the model into your work and creating the model for yourself.
Mhm.
Really looking at protectors, exiles, those conflicts between those parts, those polarizations, and sometimes how they get along. That self energy, what does that really mean? Exploring that for ourselves, for our clients. We're going to look at how to help unblend parts. So, like, I'm angry versus I have a part who feels angry. We're really going to learn how to do that. Of course, practicing the steps of the model. We will teach you the steps to unblending and how to get to know parts, and then practicing that. Looking at common concerns that a lot of protectors come in with. Again, going more in depth with those exiled, traumatized parts. Of course, looking at those cultural burdens in the context of parenthood, how they show up, and those systems of oppression, how they influence our parts to develop and our parts to not be able to develop sometimes. What we call legacy burdens, so burdens that we've, and like intergenerational trauma, those burdens that we've taken on from our family, our ancestors, and how to unburden, how that works. What does that look like when we are releasing some of these thoughts and feelings from these parts, these traumatized parts? And of course, working with grief, like we talked about, mapping our own parts as therapists, what parts come in. And then, of course, like addressing common practitioner concerns that every therapist that, or helping professional that comes in and starts working with IFS, there's like these common concerns that are always like, but what if this? What if that? So we definitely talk about those throughout the training. We have lots of time for questions, for discussion. We love, interaction with audience as we've had today, which is lovely. Kelley and I love that. So yeah, so here are the details.
Yes. So the course will take place on Wednesdays in February. There'll be 4 sessions. They are 5 hours long per day. It'll start at 11 Eastern time, run from 11 till 4. Registration is now open on our website. We have early bird pricing available until December 14th. And then she took all my information
Sorry.
away.
I'm so sorry. I don't know what happened. Go
No,
ahead.
no, it's all good. I think that's basically all you need to know. If you have questions at all, feel free to reach out to via email. Thank you to those who are saying goodbye on the chat. I'm just seeing it pop up.
Yes, thank
Feel free to reach out at any time. We are open to any questions you have. I think that's it. Christine, anything for you?
Yes, no, that's it. That's all our information.